Hey everybody, it is Dr. Liz from Helendale Dermatology. I always get asked, why should somebody get their Botox done at Helendale? My number one reason would be is that we have one of the highest retention rates for Botox patients in the country. And what does that mean? We know from market research that Botox patients will go from provider to provider looking for different price points, maybe different techniques, maybe a different location of that office, but our patients actually come and stay. And that makes me so happy and so proud because what that translates to is that we have met our patients' expectations, they're satisfied with the results, and they're happy, and honestly, that makes us happy. The second thing is that we do actually inject Botox. Now, you would think that goes without saying that if somebody says they're doing Botox, that's what they're actually getting. That often is not the case, believe it or not. There are a lot of people out there that do something called bait and switch, that they'll advertise Botox, but then they inject you with a cheaper substance, and honestly, you don't really know the difference, all right? So most savvy consumers, they're not going sort of from place to place, but someone unsuspecting may say, hey, they've advertised for Botox. That's actually what I'm getting. All of our social media feeds recently have shown a national chain that they advertise Botox versus Xeomin for $6.75 per unit. That's an amazing price for Botox. That's not a possible price for Botox, though, that you would be out of business within 1 day's time. Xeomin, on the other hand, is extremely inexpensive for a provider to buy. So all those patients going into this national chain think that they're getting Botox or Botox's equivalent, Xeomin, and they're getting this phenomenal price. The problem is that Xeomin only lasts 6 to 8 weeks, so it lasts less than half the time that Botox normally would, so your deal is no longer a deal. You would be surprised how many patients come in and they say, oh, I think I've been getting Botox. We go and we check the Alley membership. They're not in Alley. We always question if your provider hasn't been putting you in Alley, and that's Allergan's rewards program, then you probably have not been getting Botox. Because in order for us to document that treatment, we need serial numbers, lot numbers, expiration dates, a lot of unique qualifying sort of identifiers that if you're not injecting Botox, you would never have access to. So we do use Botox. A few years ago, there was actually a physician in a nearby city that he had like 1 vial of Botox in his fridge, just in case the authorities ever came. But in reality, he was actually injecting a foreign substance which he was bringing into the country illegally. His patients, I can guarantee, had no idea that they were not getting Botox. And certainly he could go and he could undercut the price of everyone because he wasn't buying Botox in the United States. He was getting a different, inferior agent from outside this country. So I always feel like you shouldn't have to say this when it comes to cosmetics, but it really does need to be sort of a buyer beware. Consumers need to understand what they're getting injected into their face. At Helendale, we only use Botox. I personally have been involved with the Botox molecule since its inception. I was an investigator for the original glabellar studies. I worked on the hyperhidrosis studies. That's the only product we've ever used in our practice. And it's really sort of the tried and true. It's very predictable. We know exactly what it can do and what it can't do. Other reasons that you should come to Helendale, we try to make that Botox experience as pleasant as possible. We try to have it really be a collaborative discussion, what bothers you, what I think bothers me, whether or not that does bother you, how much units should be used, how long we expect to get out of those units, that we don't just say, oh, you're getting this is where I'm putting it, and you're done, okay? So we do try to use the appropriate number of units. We know that a great injector can make 10 units and 100 units look exactly the same. The problem is that, those 10 units just aren't going to last. So we want your Botox to last really sort of 4, 4.5 months ideally. Yes, I do have some patients that are in here every 3 months, but they are super particular, as am I, about my Botox and stuff. I personally like to be a little frozen. They like to be frozen. I know most patients honestly don't like that, and that's a discussion that we have. So we really do have the discussion, what is the appropriate number of units? Do we think we need to go up in units? Do we think that we need to go down in units? And why that is, okay? Next is that when you're at Helendale and you get your Botox, you really get more than what you've paid for. When we draw Botox up from the vial, okay, we lose Botox in that hub of the drawing up needle. That can be anywhere between 2 to 4 units. Most physicians will sort of overcompensate for that and drop a little bit less so that if you're paying for 30 units, you are only getting 30 units, okay? The way I do it and the way the other providers do it at Helendale is we drop your 30 units and then we give you what's in that hub, okay? So we go and you always get an extra 2 to 4 units from us. And that's just, I feel like it's the genuine, sort of honest way to do it. And it's sort of our little gift to you that you're always getting that little bit of extra versus saving it for the next patient or discarding it, or really kind of trying to work out the math so that we aren't giving you anything extra. We use what we call invisible needles to inject with. The girls are icing you during the procedure. If we think that there's excessive redness or soreness or maybe a bruise, we're putting some arnica gel on you. We do have something called a corrector palette here that if you are bruised, you can purchase that. That will cover up, honestly, anything in the world, whether it be a pimple, a little red blood vessel, a bruise, anything, okay? I sort of did my eyebrow a little too hard the other day, and I have a little corrector palette on that to help tone down the redness, okay? And then what we use when we go and we've drawn up those 32 units for your price of 30, okay? Say, you end up with 33 units. We actually go and we use a zero waste syringe. We get the needles in from Japan, we get the syringes in from Germany. They are all FDA approved, okay? But there's zero waste in that you're getting not only what you've paid for, you are also getting a little extra additional. So most offices, if you go and you're getting 30 units, you think you're paying for 30 units, you're probably honestly only getting maybe anywhere between 26 to maybe 28 units. And believe it or not, every unit counts when it comes to Botox. Botox, Xeomin, and Dysport are not equal products. They cannot be sort of interchangeable at all. So advertising that interchangeability is really false advertising. A lot of people will say, I've seen ads, 10 units of Botox versus 10 units of Dysport for the same price. That makes no sense whatsoever because the equivalent is really 10 units of Botox and 30 units of Dysport. So I can guarantee when you see that ad, you're getting your 10 units of Dysport, which is a third, which is really sort of like 3 units of Botox, which, you know what, you can do at a really inexpensive price. So I always tell patients that, if you question things, if you don't understand what you're being injected with, if you don't understand, why you're not being put in some sort of reward system, Dysport has Aspire rewards, so you should always be your provider should always want to get you into those reward programs because you earn free money. Free money equals coupons. Coupons are taken off at the front desk. We only get reimbursed the face value of those coupons, not a penny more. And so we always like to try to help our patients save money. And if you're not getting enrolled into those problems, chances are you're not getting Botox or Dysport. You're getting some sort of counterfeit product or something else like that. And once again, we have one of the highest retention rates in the country, and that makes me so happy because that means our patients are happy. So thank you, everybody. I hope you have a great, day, weekend, holiday season, winter. you name it. I love all you guys, and have a great day, and thanks for listening. Bye-bye.